everyone, and thank you for joining this Lunch and Learn session organised between Boost and in collaboration with Northumbria Knowledge and Library Service. So today we're joined by Dr Quynh Nguyen, and we're going to be looking at reusable tourniquets for sustainable phlebotomy. So if you wouldn't mind moving on a slide for me, please. So we run a series of these lunch and learn sessions, generally about one a month. And the idea is that they're a space for health and care staff to come together to share experiences, learn something new relating to health and care, focus on quality improvement, and also kind of make some connections and be signposted to some further resources as well. Thanks, Quynh. If you could just move on. Yeah. Just a couple of protocols then before we get started. Feel free to turn your webcams off and note that we are recording, but we will have a bit of time for Q&A at the end where you can kind of switch your camera back on and unmute if you would like to as well. As we go through, please mute when you're not speaking and use the chat for any questions and contributions. And we can again pick those up at the end. Please listen with respect and be present as well, and do share the learning with your colleagues. As I say, we are recording today and we can share that out afterwards, so please do spread the word. Okay, so I will hand over to Quynh. Thank you so much for joining us and lovely to have you here.
Great, thank you, Amy. And hi, everyone. As Amy said, I'm Quynh Nguyen. I'm a salaried GP. I work here in the lovely northeast coast. Usually the weather is nicer, not at the moment, but it's really nice to join you. And thank you. I see David Cummins, my colleague, has signed in, and thank you to him for making the introductions between myself and Amy and the Boost Academy to share a little bit of our experience in the Northeast with introducing reusable tourniquets for sustainable phlebotomy. Quick note to say I have no disclosures or conflicts regarding this talk. So hopefully with everyone who's joined in, you've come along to hear a little bit about this because you also care about climate change and the impact that we have working within the NHS towards the climate. Of course, as an organization, we have ambitions to get to net zero by 2040, and a lot of this can be helped by reducing the single-use plastics that make up quite a bit of our carbon footprint. It is estimated that if we do this, reducing single-use plastics, we'll be able to remove in the region of 220 kilotons of CO2 emissions, which is equivalent to almost 400,000 round trips from Munich to the UK. The United Nations have also developed their own sustainable development goals, and all of the member states have agreed to these goals. A lot of them are essentially to do with the UN's goals of reducing poverty and other inequalities, but keeping in mind that we need to also tackle climate change and make changes that also preserve our oceans and forests. In the UK government also has a mandate to work on this area, and they've developed quite an ambitious goal, which they published as the Design for Life document in 2024. It's recently been updated in January of last year, and essentially their vision is that by 2045, we'll be transitioned away from all avoidable single-use medical technology products and start working towards a more circular system where things are used for as long as possible. And I think there's increasingly a mindset shift that when we start thinking about changes that we need to make, that we're thinking in 3 domains. So thinking about the people who need to be involved and who will be affected, the financial implications of any changes, and then, of course, what we're trying to look at and talk about today is the effect of the products and actions that we have on the planet. And if we sort of keep all those three things in consideration, we're probably going to come up with ideas and changes that are actually truly sustainable. So this brings us to the tourniquet. So I think we all know that these are widely used in the NHS, of course, to take blood and for cannulation. However, the single-use ones create a massive amount of clinical waste. I'm coming up to sort of my 20-year anniversary of graduating from medical school, and I'm pretty sure I've loathed these devices for that entire time because really they're quite poor from a quality and experience point of view, both for clinicians and for patients. I find they often nip the patient's skin. They're quite tricky to apply. You can't really do it with one hand. And so for that reason, we really should be thinking about an alternative that's reusable, which is going to then reduce environmental and financial waste. But at the same time, of course, we need to think about infection control considerations, but hopefully also improve the patient and clinician experience who use these. So that brings us to this newer device. It's called Daisy Grip. It's manufactured by a German company, Tristel. It's made of silicone. It's hypoallergenic, can easily be wiped down. The company estimates a lifespan of about 2 years or 10,000 uses. Of course, that depends on how carefully the user looks after it and doesn't accidentally chuck it in the bin, thinking it's a single-use one. Several papers and trusts have already looked into the infection control side, and it meets all standards as long as you have a robust cleaning procedure in place. And they cost about 26 to 30 pounds, depending on where you source it from, and they weigh about 70 grams. So this image I've nicked from a presentation that Claire Nash, who's a practice nurse and procurement lead in Black Country Alliance, presented at a talk in April 2025, and basically just looking at this idea of this circular economy for products. And you can see that, the traditional single-use ones, it's a linear economy where an item is produced, we use it, and then we have to destroy it by incineration, usually when it's clinical waste, versus something like the reusable tourniquet, which does weigh about 10 times more. But that means then, that we have to be even more cautious about using it for as long as possible, along with the consideration of the cleaning, which is the Clinell wipe. And I'll mention a bit about that in terms of the carbon footprint of that. A couple of references that Claire has shown on here is regarding work, including by the working groups that are in the Design for Life government project. And they analyze the life cycle, from extraction of raw materials to production and use and destroying a product. And it's quite complex maths that I can't get my head around. But essentially, when they do these maths for all kinds of different products, almost always a reusable product comes out on top in terms of the carbon and the climate effect. And so just a couple of notes to say, when you start to try to then actually look at calculations for whether a product is sustainable, you've got to consider, of course, the cost upfront of buying them, the weight of waste, both of the new product versus a single-use one, the cost of waste disposal, and then the overall carbon emissions that go with the life cycle of the item, which is commonly displayed in this kilograms per CO2 emission, which you'll see a few times in the later slides. So as I mentioned, there's several trusts that have already transitioned to a reusable tourniquet, and they've been able to do the calculations. Just as a reference, the Daisy Grip has a small footprint per use. Again, you're thinking about this 10,000 uses or 2 years as a lifespan, and that almost the entire majority of the emissions is due to this Clinell wipe that is a common way to clean it. Depending on what is common in your working place, and in some trusts they use a different type of disinfectant spray. That is, I don't have the full calculations, but that might be a less carbon intensive process to clean them versus the wipe. But where I work and in our trust, it is typically just to use the wipe, one single wipe to clean the product after. Having said that, and considering that the wipe does have a significant carbon footprint, the combination is still 45 to 50%-ish lower than single-use tourniquets. And previous work, again, by Claire Nash that I mentioned there, have looked at that, the life cycle analysis, it's about a fifth for a reusable tourniquet per ton than a single-use one. And yeah, as I mentioned, several other trusts, including Mid-Yorkshire, have previously, since 2022, transitioned to a reusable daisy grip tourniquet, and they were able to show significant savings both from a carbon side and from the procurement and financial side. And I think, realistically, we are all aware that saving money is important, and it should be part of the discussion in terms of trying to make a shift. So starting to look at what we've been doing in the Northeast and just thinking about the process that you have to go through, we really have to start with identifying what we want to change and why. So in this case, it was about the single-use tourniquets, and you have to discuss with your relevant stakeholders and get their agreement that it meets all the criteria that is needed in terms of infection, financial, sustainability. Then look into the procurement and get the appropriate training for the users who will be having to evaluate whether the product is actually satisfactory, and then to do a sort of analysis and get feedback from users, including patients, about whether the new product is acceptable. Again, yeah, looking at this whole process, looking at this triple bottom line idea of people, planet, and the financial impacts. So our Northeast experience, so first looking at our wider trust, Northumbria Healthcare Trust looks after about 500,000 people in a very sort of broad geographical area in Northumberland and North Tyneside. It operates several hospitals and community services, and it's one of the largest trusts in England. In around 2023, they started trialing and transitioning to the Daisy Grip reusable tourniquet. And before that, they collected the data to see how many single-use tourniquets they were going through. They used about 500,000 in that one financial year, and knowing that those tourniquets weigh about 11 grams, including the plastic that they come in, and the cost of about 10p each. That was costing them about 45,000 pounds a year, creating 5.5 tons of plastic waste, just about over 2,000 for the disposal of the single-use tourniquets, and the carbon emission associated with the disposal, not including transport, was about 107 kilograms of CO2 emissions. Now, I've just put in a little bit on the bottom there that bigger trusts like NHS Greater Glasgow and Clyde had estimated they used close to a staggering 1.8 million single-use tourniquets a year. So all these numbers, for Northumbria Trust, you could multiply by 3 or 4-fold for bigger trusts that are using more. So since they've transitioned since 2023, they've been able to provide a bit of an analysis of the impact. They did start as a trial in theaters in one of their trust hospitals, and then after initial very positive feedback from users, expanded to other sites within the trust: oncology, maternity, radiology, and critical care. In terms of the kind of clinical and feedback side, 94% positive feedback from users, a lot of them saying that they never go back to the single-use ones. They love their Daisy Grip, and a lot of staff agree that it was an important change to make because of it reducing waste and emissions. Financially, the trust has so far purchased just over 400 of these Daisy Grips, and there's an obvious upfront cost there, about 11,500 pounds in order to do that. But comparing that to their costs of single-use tourniquets, this 500 odd thousand, it still represents a savings of almost 40,000 pounds a year. In their analysis, they think that after about 320 uses of the Daisy Grip, it becomes cost neutral except for the cost of the ongoing wipes. And environmentally, with that reduction of single-use tourniquets, they're saving about 6.5, sorry, almost 7,000 kilograms of CO2 emissions to dispose of those plastic single-use ones, which equates to about 16,000 miles in an average car. So that was in 1 year. And then just talking about our experience in our primary care community settings. Northumbria Primary Care, where myself and Dave, and I don't see if anybody else of our colleagues is signed in today, but we're a subsidiary of Northumbria Trust. NPC, in short form, operates 12 GP practices with about 125,000 patients, again, across Northumberland and North Tyneside, and it's coming up to its 10th year as an organization. So my involvement started in July 2024 when I was thinking about, after the pandemic, all that single-use plastic that we used, and cringing every time I was throwing them one in the garbage, and thinking with the phlebotomy, which I don't do that often, but as I say, I really do not like those single-use tourniquets. They're just awful from so many levels, and so it planted a seed in my head of could we change to something that's reusable? Was there a reusable option? And was anybody using them? And so I sent an email to our head of nursing within the community, NPC, and also to Ruth Heinen, who couldn't be here today, but who's the head of infection control in Northumbria Trust, just asking that question, is there an alternative? And I was actually shocked that Ruth replied from the trust side about their transition over the last 2 years. And I thought, what a shame that we weren't aware, but also it was great that this was already sort of implemented in the trust, and they'd already done the infection side. They already had the numbers about the carbon savings and the financial savings. So it made it quite a lot easier to kind of push that agenda forward in the community. And so unfortunately, at this point, it's still relatively early days for us, and I haven't been too successful in getting all the data from the practices that have the Daisy Grip now, and I've been using them for about six or 8 months now. Where I work in Spring Terrace, one of the 12 surgeries, I did troll through our invoices from May to April last year, and found that we were ordering somewhere in the range of 1,500 single-use tourniquets at a cost nearly 500 pounds, and producing, because they weigh about 10 grams, these button ones, 15.5 kilos. And knowing that our practice, we have 2 HCAs and 3 practice nurses, and some of the other NPC practices have double that. So you would maybe estimate that they're seeing 2 to 3 times as many patients a week, and going through higher volumes of the single-use ones. I believe now 10 of the 12 practices within the NPC umbrella have Daisy Grips on site. So yes, as I say, early days, and I don't have as much data as I would have hoped to share with you, but from the clinical side, just recently tried to send out some user feedbacks, and I naively thought everybody loved this product because I've used it, at least 2 dozen times, and I think it's great. But what I realized on the feedback was that a lot of users were finding that it was awkward to put on and remove, and they were concerned that it was nipping the patient's skin. And I'll mention this in the next slide, but this really comes down to adequate training before the product is used for the first time, and a bit of practice. Financially, again, I'm sorry, I don't have the data, which I'm trying to collect from the 12 different sites, because procurement is within each of our GP practices. And to be honest, I think people just don't have time to look back through their invoices and give me the information, but I'm going to work on that. But if you look at, do a rough calculation, if the tourniquet lasts for 10,000 uses, the full cost is of the Daisy Grip where we order it is £30 and change, plus 10,000 Clinell wipes, which is 160. So that gives you just under £200 for the life of tourniquet versus 10,000 single-use tourniquets, where we order them would be at almost 3,000 pounds. And then environmentally, I'm extrapolating for if all the 12 sites within our organization were using them, we could reduce per annum our plastic waste by just around 2,000 kilograms per CO2, which is about 5,000 miles in an average car. But yeah, in the bottom there, I've mentioned, we still have to consider the waste that's produced from a clean-out wipe that needs to be used after each use of the tourniquet, and they weigh about 5 grams. So a few considerations. Some people have mentioned and concerned that the Daisy Grip, it has a magnetic buckle, which is actually, as a user, I find really good because it clicks by itself, and then it's quite easy to remove with one hand. In any patients who have a pacemaker, you just have to have a little bit of distance from the tourniquet and the pacemaker, but it's not an issue, and it's never been shown to be a safety concern. There may still be a need for the single-use tourniquets in some situations. And as I mentioned, with the kind of surprisingly poor feedback from in our community sites, this really comes down to getting adequate training before you roll them out. The Tristel reps are very accommodating and can arrange to come. Logistically, it can be difficult to coordinate staff to be present, at the same time. But yeah, you might have to do it over several sessions. And then I'm just going to see if this works, and I'll just click quickly to show you if this video. Let me know if it doesn't work, Amy, when I'm trying to share it. Can you?
Yeah, I can't see anything at the moment, Quynh.
Is that working?
No.
No. Okay.
We could share the link afterwards.
Yeah. So we'll not worry about that. But essentially, it's just to say that it's not quite the same as a traditional tourniquet, that you can't just put it on the patient arms and just tighten it. You have to use a C technique, it's called, and that means to put your index finger between the patient's skin and the buckle as you tightened it, and then you just slip your finger out. And in doing that, you prevent any of the nipping of the skin that is obviously not desirable and should be avoided. So last couple of slides is just to say that, yeah, the main barriers that we identified that would need to be considered for anyone else who's wanting to transition is to make sure you've got the adequate education and training about the product. Make sure you have a robust decontamination procedure, but essentially, for most places, it's a simple wipe down with the Clinell wipe and then leave it to dry between patient uses. Obviously, you have to look at the cost side, including the upfront cost of purchasing them. And then the part that we're still working on now that we've rolled it out is to review the feedback and the teething barriers, the teething issues that people have had, and try to address those. A little bit in the bottom there was just to say that, yeah, there are high traffic and high volume areas where these tourniquets may not be as desirable because of trying to maintain the cleaning procedures and try to prevent people from accidentally throwing them away. So yeah, in summary, Simple Trusts, including ours in Northumbria, have already shown that these reusable tourniquets balance cost, sustainability, and clinical and infection needs. Except for the caveat of what we've seen a little bit so far in the community, it's really a positive response because they are quite easy to use, preferred by patients and staff, and save money along with the climate impact, but that adequate training is essential. So yeah, I think it ticks a lot of boxes, and I struggle to see any negatives.
Fantastic.
Yeah. Thank you very much. Yeah, just a couple names there to mention, including David, who introduced me to Boost and to Amy, and our colleagues in the Northumbria Trust who shared their data.
Thank you so much, Quynh. That was really interesting, and it's great to consider kind of these improvements in terms of that triple bottom line perspective. As you say, it's not only the reduction in emissions, is it? It's the other benefits that it brings as well. So does anybody have any questions or any thoughts that they would like to chip in with? Abigail, you've got your hand up. Come in.
Oh, thank you. Oh yeah, that's really good. And I have seen a rep try it on me because I was worried that it looked like it might pinch, but actually it didn't at all. And I was really surprised how comfortable it was. So that, yeah, so highlighting the training is probably worthwhile because the rep did it great. What I was going to ask is, how do they have an expiry date on, or how do you keep track of when the 2 years is up? Of like your 10,000 things? Do you write on when it was started and then keep an eye on the 2 years coming up, or how do you know when it gets to 2 years?
Yeah, it's a good question. I don't think it has a formal expiry date, Abigail. It's just really when it starts to look worn, in terms of the silicone breaking down, or any kind of sediment kind of building up on it. If it's been cleaned so many times. So I think that's the main thing, is just to keep an eye on that. But yeah, I don't know if we'll ever be able to measure has it survived for the full 10,000 uses, because obviously no one's really counting. So.
Fantastic, thank you. Any other questions? David, feel free to come in.
Just a comment, really. Well, first of all, thank you, Quynh, and thank you, Amy, for putting it on. Thank you, Quynh, for the presentation. I found the numbers fascinating, and really when the plastic problem is scaled up across the UK, just the numbers are quite bewildering. I think when I was trying to do some basic maths there, and I'd seen this figure before, the 1.8 million single-use tourniquets used in Glasgow, it got me thinking, well, how many were used in an average year in the UK? And a quick Google told me that NHS trusts ordered about 60 million of these in 1 year. And then I think the data will tell us that probably half of the bloods that are done in the country will be sort of ordered by primary care. So I think, as well as trusts shifting towards the Daisy Grip and other reusable tourniquets, just if we can get this message spread far and wide so that PCNs and primary care GPs can procure this product, I think it would be great. So thank you again for your presentation.
Thanks, Dave. Yeah, great point about the particular impact and the percentage of bloods that we are doing in the community. It's high.
Yeah, thanks, David. And as you say, it's mind-blowing when you kind of total up across the UK, kind of the potential for the savings there to be made. I have a question, Quynh. Did you experience any kind of resistance amongst your colleagues when you began this process? And kind of, if you did, how did you overcome that?
Oh yeah, I think, to be honest, there was, and I think it's that inertia, Amy, it's like, well, we've been doing this for so long. We've had the single-use ones on site for so long. It's trying to get that ball rolling and sort of convince people that it's not so hard, in terms of the procurement. It's already been established in other trusts. Here are the savings, here's the implication. So yeah, I think it's really helpful that it's already been used in different places, and I was able to, in that initial email, just say, here's some information that I found. Here's the other trusts that are already using it. Here's the savings. And then especially with the infection side, that was the initial kind of concern from one of our nurses in our practice, was, does this meet infection control? And I was like, well, compared to I actually fished this one out from, this is like, when you were a house officer and you were walking around with this canvas one in your pocket, and that was your lucky tourniquet, and you use that all the time, because I hated the single-use ones. This is horrible. So yeah, I said, like, anything that can be wiped down periodically, even if you didn't do it all the time, which obviously I'm not advocating for. You should wipe it down after every use. The infection side was not an argument either. So yeah, it made it easy that other places were using it. And so hopefully, if people have this recording and want to share it, there's as I say, there's I've got 2 pages of references, so with links there to the studies that have already been done about it.
Thank you so much, Quynh. And yeah, conscious we're now at past, so I want to say thank you again for that really interesting presentation, and thank you, David, for putting us in touch. Thank you so much to everybody for joining, and yes, please do share and spread the learning. So our next session that we've got happening in terms of the Lunch and Learns is on the 3rd of March at the same time, and we'll be hearing from the HealthWorks organisation and how they're driving impact and reducing health inequalities across the region. So, and I'll just pop the link in the chat to those other dates as well. We've got a couple more happening on 18th of March and 29th of April, so please do take a look at those and see if there's anything of interest. So thanks everybody once again. Nice to see you all, and yeah, enjoy the rest of your day.
Thanks everyone.
Thank you.